Hello, my name is J.Tufano and this is N495. I am doing a head-to-toe assessment on a patient. This is my friend who's going to be assisting me in my presentation today. First, I'm going to ask her 2 questions. I just need a yes or no answer. Do you give me verbal permission to participate as a model in this assessment assignment and be recorded for school purposes for Aspen University Class 495?
Yes.
This assessment is intended to show my skills with the assessment action only and not to be used as direction for your health status or follow up with any irregular findings. Do you understand this?
Yes.
Perfect. Before caring for any patients, you always want to wash your hands. So we're going to assume that I did wash my hands already. And then you come into the room, you introduce yourself. Hi, my name is Janice. I'm going to be your nurse for today. Do you mind introducing yourself and giving me your date of birth?
Sure. Kelly Claire, 8/12/1966.
Okay. Looking at the look at my patient, I can see that she's not in any distress right now, and she's A&O times 3. So we're gonna check out her vital signs to start with. First, we're gonna check her temperature. I don't have a thermometer right now, so we're just gonna assume that I did check her temperature, and then we're gonna check her blood pressure. Miss Claire, I'm just gonna borrow your arm, okay?
Okay.
How are you feeling today?
I feel great, thank you.
Just gonna rest your arm over here, okay?
Mm-hmm.
Then we're gonna check for pulse. Good. Blood pressure is 120/85. Pulse is 75. Respiration is 15. Normal rates. Are you in any pain right now?
No.
Very good. Now we're gonna check her head and neck and her face. So we're gonna check for any abnormalities in her head. Very good. We're gonna check for her temporal arteries, the carotid arteries, very good. Can you open and close your mouth? Perfect. We're checking for TMJ. Thank you. Now we're gonna check for her trachea. Do you mind scooting to this side, Miss Claire? Now we're gonna make sure that the trachea is midline. Very good. Can you give me a swallow? Very good. Now we're also gonna check for any lymph node abnormalities. Can you shrug your shoulder down? Bring it down. Thank you. Good. Now can you clench your jaws for me? Good. Give me a big smile. Very good. Give me a big frown. Thank you. Now can you repeat a few words for me? Say light.
Light.
Tight.
Tight.
Dynamite.
Dynamite.
Good. Now we're checking for the cranial nerves. Now we're gonna inspect for her skin. Skin is good. Skin turgor. Skin is warm. We're gonna capillary refill. Very good. Less than 2 seconds. We're checking for any pedal edema. Thank you. Now we're gonna look at your eyes, okay?
Okay.
Externally, eyes looks good. Now, can you look up for me? Look down, to the right, Just your eyes to the left. Very good. Now I'm gonna shine a light to your eyes, okay? Gonna put my hands in between your nose, checking for responses. Very good. Now can you cover one eye, cover your right? Okay, I'm gonna wiggle my fingers and can you tell me now if you see them?
No. No. No.
All right, we're gonna do the other eye.
No. No. No.
Very good, thank you. I'm gonna shine the light again, okay? Any problems with your eyes lately?
No.
All right. Thank you. All right. So that was our eye exam. Now we're going to check for her ears. I'm just going to expose your ears, okay? Externally, I don't see any problems. We're going to check for any abnormalities or any drainage in her ears. Now we're going to look at her ears internally. I'm just going to poke in your ear, okay?
Okay.
Am I causing any pain?
No.
Thank you. All right. Your mucous membrane looks good, clean. Thank you. Now we're gonna look at your nose, okay?
Okay.
Now I'm gonna check your maxillary sinuses and your frontal, sorry. Any tenderness?
No.
Any tenderness?
No.
Okay. Can you pick up your head a little bit? I'm just gonna look internal or your nose, okay? Mucous membrane's good. No injuries lately?
No.
Okay. Can you open your mouth? I'm just gonna check out your mouth, okay? Say ah. Perfect. Move your tongue right to left. Very good. Thank you. No injuries that I can notice. Nasal passage good. Cavities or colors moist and no the tongue and the teeth are all good. Thank you so much, Miss Claire.
You're welcome.
Now we're gonna move into your lungs and your chest, okay?
Okay.
All right, we're gonna palpate for any masses. All right. Now, Miss Claire, I'm just gonna ask you to stand up for the purpose of the study. I'm gonna ask you to turn around. All the way this way, Miss Claire. Can you say 99 for me?
99, 99, 99, 99.
All right. Now I'm gonna listen for breath sounds, okay?
Okay.
Deep breaths. You're gonna avoid auscultating on the bony prominence, obviously. Deep breaths, Miss Claire. Okay. Now we're gonna palpate for CV tenderness. Anything there?
No.
No problems with your urine lately?
No.
Okay, we're gonna turn around and we're gonna listen to your chest, okay? Deep breath. If you ask the patient to pick up their arms, you can hear the lower lobes better on this side. Okay, we'll do the other side. All right. Thank you, Miss Claire. Now we're just gonna listen for your the carotids also, okay? good flow. All right, now we're gonna check on your abdomen. I'm gonna ask you to lie down. All right, so I'm not gonna ask the patient to expose her belly for the purpose of the study and her privacy. So we're just gonna make sure that you inspect the abdomen for any abnormalities, and then you're gonna auscultate. You always want to listen to all 4 quadrants. Normal bowel movements?
Yes.
No problems?
No.
Okay. Then you just want a light palpation. Take a deep breath. Out. In and out. Thank you. Are you comfortable?
Yes.
All right, now we're gonna check for your joints, okay? I'm just gonna
Okay.
ask you to pick up your arm. Gonna move your arms a little bit, your joints. Any discomfort lately?
No.
Are you able to move them by yourself without any discomfort?
Yes.
How about the other side? Perfect. Now I'm gonna pick up this leg, bend this knee. Any problem with that?
No.
How about your ankle?
No.
Very good. Can you do the other side? Very good. Now we're gonna check for pulses. Now we're gonna check all the pulses in your foot, okay?
Okay.
You're gonna check you're gonna check for the dorsalis pedis. You have good pulses, Miss Claire.
Thank you.
Now I'm gonna ask you to sit up. You're gonna sit at the edge of the bed. Now we're gonna do some neurological testing, okay?
Okay.
I'm gonna ask you to stand up. All right, I need you to just,
Sorry.
that's all right. Walk heel to toe, walk towards me. Very good, thank you. You may step back. Now I'm gonna ask you to, with your eyes closed, arms to the side, pick up one of your leg. Up in the air like that. All right, now do the other side. You all right?
Yes.
I should really be on the other side just in case you do lose balance. I should be able to support you, okay? All right, so now I'm gonna ask you to have a seat again, and we're gonna check for reflexes, okay?
Okay.
I don't have a reflex hammer, so I'm gonna use the bell of my stethoscope to check for reflexes, okay?
Mhm.
All right. I'm gonna do that again. Thank you. All right, one more time. All right, now you're also gonna do that on the other side. Are you able to scoot back more to the bed so your legs are hanging? All right. All right, thank you. And one last test for the neurological testing. I'm gonna ask you to do this alternating. All right, and then I'm gonna ask you to, with your tip of your finger, touch the tip of your nose and touch my finger. All right, keep following. Keep following. Keep following. This test your cerebral any malfunction. That completes my head to toe assessment. Thank you so much. Thank you, Kelly, for assisting me today.